The benefits of helping someone feel better, function better, live the life that they want to live is exactly what I'm here for. And to see a patient come in that's not feeling well because of their cancer, they're sometimes a little bit on the fence about whether they want to go through all of this, but then to see them go through these treatments and tolerate them and feel better and get back to the life that they want is so meaningful. And oncology offers great relationships with patients and their families for the long term. And if you can merge that with the technology and the growth in oncology, I really think it's the perfect setting for me and to give me the satisfaction that I want involving relationships and advancements in science. That first visit with a patient with cancer can be really challenging for everyone because we're getting to know each other and conveying a lot of information. One of the advantages here is that I have a really fantastic team of nurses, medical assistants, social workers that can kind of tackle this from every angle to make it as easy as possible in a really difficult situation. But to have that chance to sit down and approach it from scratch and go through the details and go through the options, even if you're on a pathway where you've started treatment with another doctor, it never hurts to come see me to talk about future options or future things that we could do to make life better or longer or easier. One of the best things about working at Siteman is the cutting-edge clinical trials that we have available. At other institutions I've been at, we've had a handful of trials here and there, but they may not always meet the majority of the patient's needs. Here we have such an interesting collection of studies that are really cutting into trials, moving away from chemotherapy, immunotherapies, molecular therapies are really advancing. It's been a level of opportunity that just exceeds other places that I've seen, and it's really valuable for the patient. I think one of the most exciting things about the future for cancer care is our ability to limit toxicity and improve responses to treatment while maintaining excellent quality of life. Many patients come to me and their main goal is, I really don't want to do chemotherapy. What else do you have to offer me? And one of the advantages here is we have these fantastic trials that are chemotherapy free or offer opportunities to avoid chemotherapy or look at new technologies that can really meet the patient's goal of avoiding some of those traditional chemotherapy side effects. One of the things that we look the most forward to is how these current trials and advancements are going to affect life for patients in the future. And every year there is something groundbreaking that's going on. And that's really awe-inspiring to think of all these researchers creating these tools and us delivering them to the patients. I think the potential for continued improvement is really limitless at this point. So when a patient meets the end of their time with me, where we've spent years together and they've done really well with their cancer and it's time to part ways because we expect the cancer not to return, it's a really challenging time. That separation and that support for a patient can be really difficult to lose. And we try and bridge that with our survivor clinics here, relationships with primaries to give advice. It's hard to see a patient go after 5 years or 10 years of watching them do so well. And sometimes you just can't close the door and they can't resist that once a year check-in visit. Every situation is unique, and I've definitely had patients that come in that are not doing very well and very afraid of what the treatment might entail. But there are specific patients that come in and just everything turns around. The fear gets under control and the cancer gets better and life gets better. And to see that kind of success for someone that was so scared and so really beat down by the cancer is hugely satisfying for them and their family and for me.